So for this part of the session, we will hear from the World Health Organization Western Pacific Regional Office, and the concept of AHIN actually took seed with the support of the WHO WPRO, with other development agencies way back in 2011, and even way back before that, because the leaders both in the government as well as the national in the academe were beginning to see themes, and saw that the idea of working together as peers, no, learning from each other, was actually a logical next step in their efforts to towards digital transformation in their own countries. So with that, AHIN was actually formed in 2011 through the support of WHO WePro. So now we'll continue to hear from WHO WePro, and we'll see what is the latest through the introduction of the WHO Dynamic Digital Health Maturity Model and the Data Management Competency Framework. We will hear from the technical lead of the Health, Information and Intelligence Data and Strategy and Innovation team at the WHO WePro. Please welcome Dr. Mengjuan Duan.
Thanks a lot for inviting WPRO being here, and it's so exciting to see all of you face to face. Before we only able to meet each other virtually. So for today, I'm going to introduce the ongoing activity projects in WPRO. Actually, we nearly finished. Hopefully, you can see the publication very soon, maybe in 1 or 2 months. So before that, I'd like to introduce myself. I'm Duan. You call me Duan, maybe it's easier, even though it's my family name. And I'm currently the technical lead for Health Information and Intelligence Unit. For our unit, we are mainly focused on strengthening health information system and the digital health, as well as CRVS system. So it's covering multiple area. And we have our new director, Dr. Kido Park, was on board since May of this year. So he also set up several priorities on digital health in our unit. So that's why I'd like the details. So besides of sharing the tools and framework, I wish to quickly recap all the WHO related strategy and action plan. So as many of the speakers have already mentioned, one of the important toolkit, which is the National E-Health Strategy Toolkit, developed by WHO and ITU 10 years ago, 2012. It's very helpful. We also observed that several countries are using that tool to develop their own national strategy by using the 7-pillar structure. So after that, in 2019, WPRO will also developed our regional action agenda on harnessing e-health for improved health service delivery in our region. And for that action agenda, it's mainly focused on document all the related digital solutions from different member states. And in 2021, all of you are already familiar. We have our global strategy on digital health public release. And for that one, we clearly see the concept of e-health already being expanded to digital health, which you are also very familiar with that. It's a broader umbrella to including more emerging technologies such as AI, big data, etc. And based on that, in order to implementing our global strategy, our office now is developing our regional digital action plan. Hopefully, it can be published in next year. So in order to develop our action plan, what we are doing is to finish maturity assessment for all our member states. Actually, most of the PIC countries, we already finished 1 or 2 years ago. Maybe you also know that, which Professor Tan's team helped us. And now we are trying to finish all the non-PIC countries, which I'm going to introduce very soon. And besides of that, I also show you the priorities for our office in this year as well as next year. So we have been provide tailored country supports for mainly three key areas. Number one is to help our member states to either develop their national digital health strategy, roadmap, or action plan, or update their one. So we received several requests from different member states, especially since last year, and some of their regional, national digital health plan is nearly out of date, or they are going to develop a new version. And we have observed lots of missing area, which is not covered by the 7-pillar structure developed 10 years ago. Normally is the digital health inclusion, digital health equity, people centralized information system. So basically those areas are missing for most of the digital health strategy from some of our member states. And also we are providing concrete capacity building for institutional level as well as health workforce level. I believe several of you maybe joined our digital health training last year. We have 180 participants from 18 member states totally in our region. And to build on that training, we are now actually developing the regional training package, which is built on the suggestion from all our participants last year, because our participants request us, WPRO, please give us more case stories to show the true challenges and the true successful stories in the field. So that's what we are doing, trying to develop all this case story. We already established the expert panel in this year with around 17 experts from 7 to 9 countries, not only limited in WPRO, but also some experts from Indonesia, Sri Lanka, as well as Canada. So we are hoping to summarize all these good case stories, not only success ones, but also challenge ones in our region. And the third area, which is quite common, is to focus on provide concrete support on extra digital health solutions. This is the third area is mainly collaborating with our technical units such as immunization, disease control, NCD, as well as our emergency COVID-19 response team, and also our innovation units. So for that area, we noticed in our region, in West Pacific region, we are not lack of digital health in creative solutions at all. So we hope we can document all those information as well to share through different channels, no matter our innovation team or our own team. So thanks a lot for giving me this time to introduce some of the background of our region. Now I'm going to introduce the maturity assessment tour. So I'm very excited. I was very excited this morning when I heard our first speaker is also to introduce the global digital health index. That's a very useful tool as well. But meanwhile, we also wish to introduce the WHO one. It's developed based on our global digital health strategy, which was published last year. And for this maturity model, like I said, it's trying to cover more indicators, which is missing from the 7-pillar structure published by WHO and ITU 10 years ago, and which are people centralized information system, and as well as digital health equity and inclusion. So this maturity tour actually was based on an assessment of all the existing digital health maturity tour from different regions of our countries and member states, as well as some international organizations. And then it covers totally 80% of those indicators. It also has 20 more indicators to cover the emerging new area, like I just explained before. So basically, we mapped over 500 indicators totally and able to select the most important 40 indicator to make sure this tool can be implemented flexibly and in a short time period. Since we call it dynamic, so we are expecting we are able to evaluate every 2 or 3 years rather than have a very comprehensive model with hundreds of indicators cannot be finished within 2 years. So that's the key change for our maturity model. And also like we said, we hope the function of this module play the role as routine monitoring and evaluation, because our digital health area is developing so fast. New technologies is booming every day. So we hope we are able to use this tool to actively monitoring the ongoing readiness and status, and also help us to set up the priority in different countries. Of course, this tool can be easily tailored or adapted by member states or countries to do some subnational level evaluation as well. So currently, it's an Excel-based tool, but what we are trying to do is to transfer it into an online platform, which able to help the user simply upload their data and the information, then automatically generate all the results, which I'm going to show very soon. And then we also classified all the evidence, which means the data submitted into 3 levels. So because digital health maturity assessment from multiple tools, we noticed it's kind of like qualitative and quantitative combined assessment. That's why most of the evidence or data are from different types of documents. That's why we clarified the evidence level into 3 levels as well. So to make sure when we read the results, our decision makers and our public will be confident enough how this information can benefit to their routine life. So here is some initial results for WPRO. Currently, this results is including 12 member states data, which are non-Pacific Island countries. Like I said, we already finished the Pacific Island country analyzing 2 years ago by using a more comprehensive maturity model, which including more than 150 indicators. But now we transfer to this simple version with only 4 core indicators. So we are going to merge PIC results and the non-PIC results in next 2 weeks. So basically, we're able to have the whole WPRO level results in 2 weeks. And if you see the demo here for only 12 member states, we showed our maturity from 9 area. So you can see it's broader than the 7-pillar structure comparing with the guidance published 10 years ago. We are having infrastructure, tools, applications, and services. Actually, these 2 areas for most of our non-PIC countries are quite mature. 2/3 of our member states are quite mature on there, but for the standards and the interoperability, it's need a little bit development. And for governance side, it still have some missing roles for some of the member states. Legislation, policy, as well as the complex similar issue as governance. And we still need lots of more investigation and financing support on this area. And for workforce capacity building, also need a long journey to go. For if you see the 3 area, which I mentioned, the emerging area, which was not covered before, there are lots of gaps here. We have even data gap. We don't even have any information from most of the countries for this 3 area. Even though for the country we have the information, it's less mature or limit in somewhat mature level. So hopefully this information can be useful to give you an overall idea what's going on in our region. But like I said, it's have not been merged with PIC results. After we merge PIC results, maybe the dynamic will change a little bit. And for this work, we started in May of 2022 and already been finished in last week. So going to finish merging PIC results in next 2 weeks. Hopefully, after we finish that, we are able to share these results with our member states expert team to get your validation and suggestions in the next step. So what we did for this time, a little bit different, is we invite experts from different countries. We believe even the tour is very useful, but only the experts inside of the country know their country better, especially for the country who are non-native, non-English speaking country. They have so many existing documents which only available in their own language. But we communicate or misinterpret that information as non-existing or missing because they don't have English version. That's why this time we have experts from China, Australia, Korea, and Japan directly there. And we are aiming to have more experts from other countries such as Singapore, Malaysia. So we are trying to approach to them in next 2 or 3 weeks. So today, using this platform, I also wish to invite any experts from the country to connect with me, make sure you are in our loop to evaluate or validate these results and also contribute to our regional action plan, which we are developing. Because like I mentioned, the maturity assessment is only the preparation documents for action plan. Unless we know what's going on in our member states, what's the current status, we are able to develop the action plan, make sure it can achieve to our future vision of digital health. So here is another way of showing the results. We categorized our digital health indicator, maturity indicator into 2 dimensions. One dimension is on ICD, infrastructure, information sharing side. The other dimension is on the health system readiness, such as enablers, as well as social environment. So you can see several countries in those non-Pacific area are actually able to achieve maturity level for both of the dimension. But unfortunately, some of them are still focused on strengthening infrastructures only or improving interoperability standards, but still lack of the equity or other governance and leadership. So we are able to add PIC results as well as I repeated several times in 2 weeks. Hopefully at that time that these results can be publicly shared with our experts team. So like I mentioned, because we're going to develop our regional action plan, we are now establishing experts panel. So we wish to organize an informal experts consultation in December of this year. And next year, we wish to organize a regional level formal expert consultation meeting next year in March. And in July, wish to organize a regional member states consultation meeting. So through this consultation meeting, we are able to show the digital health maturity assessment results, as well as our draft digital health action plan. That's why I really call for experts today to join us to work together with WPRO to make sure our documents reflecting the reality of our member states, not only the outsider who are trying to give some summary. So that's all for the digital maturity assessment tour. Meanwhile, I also wish to take this opportunity to introduce another tour, which we developed for the past 18 months, which called the Data Management Competency Framework. This framework hopefully can be published within this year as well. Now we are enter to the long publication procedure of WHO, even though the draft is nearly there. But luckily, we are also able to pilot in 2 member states. I will show you some of the exciting findings later. So for this competency framework, it's trying to provide a tool or methodology to plan and drive the competency development of health information workforce across different levels of health institutions and organizations. And our target audience is health information related decision makers, managers, implementers, as well as our frontline health information workforce from different levels, not only national level decision maker, but different level until health center level. And this competency framework, we totally have 4 core competency area, which covering data generation, processing, analyzing, and usage. So inside each of the competency area, we have 4 to 5 domains trying to cover the whole data life cycle. And for each of the domains, we defined the skills and the knowledge for 4 professional level, learning beginner until master practitioner. So here is the 17 domains I just mentioned. You can see it's actually trying to cover the whole data life cycle from planning until transfer to actionable recommendations. So this kind of framework is missing based on our literature research 2 years ago. We know everyone is talking data life cycle as talking we need a capacity building on data analyzing, on data cleaning, but there is no framework or no tools to give them very clear definition. Sorry, I only got 1 minute, so I will try to be quick. There is no clear definition of what exactly the skills and the knowledge are requested. So here is an example for one of the domain to show we defined the definition for each of the domain. And also we defined very clear skills and knowledge required for each of the professional level. This is also one example from data creation domain. And because so many people saying, I need a capacity building on data analyzing. So when we're asking what kind of data analyzing, then the answer is, sorry, I'm not clear. Data analyzing also has 4 domains. We also defined the skills and the knowledges. So how we are going to use it? So we hope with this framework, we are able to create some standardized data profile to different types of health information workforce. Here is a profile for such as a national surveillance and focal point in one vertical program. We're expecting this person have more mature or master level on use of the data, analyze of the data, but maybe basic level for generation and collection. But for frontline health center data person, we wish they have more mature level on data collection section and less mature level on the usage. So it's really up to the health information workforce. Where are you working and which country you are working? Some of the country, they may expect that district level health information workforce has the very standard and professional level, but some of the country, they may only limit it to national focal points. So that's the key findings, key examples we are showing. So like we said, we are already implementing this framework in 2 member states. One of the member states actually gave us lots of good, broader impacts and benefits we observed. They are not only able to measure their gap, competency gap, they are also able to develop their long-term capacity building plan. So they are able to give the 3 types of health information workforce in their country for both national level and provincial level, give them a standardized profile. Based on that profile, they are able to detect the gap. And based on the gap they detected or measured, they are now developing a 3 to 4 years capacity building plan, trying to make sure all the health information workforce from these 2 levels can be strengthened, not only leading by donors or leading by some rich vertical program like immunization or disease control. Now they are trying to cover everyone as long as they are taking similar roles and responsibility. And we also very happy to see they are linking with their future HR contribution. So basically, they hope to update their job description in next step and also link with HR recruitment, selection, individual development. So that's the exciting impact we observed in one of our member states who have been implementing this framework. Hopefully, it can be also useful to other member states as well. I may stop here, and sorry for delay. Over.
Thank you, Dr. Duan. And indeed, we're excited with the output of WHO WPRO. And certainly, as a community doctor, I've been hearing also local governments trying to understand how to manage their data better. And I understand that they are, in fact, getting some help from the DOH. So I'm sure WHO has also been supporting. So thank you very much for that. And we'll continue the conversation. We'll be around. Okay. Thank you again, Dr. Duan from WHO WPRO. Our next, yes, a question or two.
It's very interesting to hear from you the work, and then especially you mentioned about regional package. This is something that which AHIN community could possibly work together and contribute, because we are also doing this cohort of digital health planning national systems now for 100 participants from 13 countries in the region. So it's ongoing right now, and then it will get completed in the month of December. And then we also have Sean Blaschke from DICE UNICEF and Merrick Shepherd from USAID who has been supporting us. And then we plan to actually put together a community of those alumni who have passed out from this trainings, because if we don't actively engage them into something that is meaningful on a continuous basis, that the training goes waste. So this is something that we could probably work together. And then regarding the maturity models, I think there are plenty of such tools. My request is because sometimes the countries feel there are too many tools. So is there a possibility that we can harmonize or ensure there is an interoperability of information between the across the tools? So thank you very much.
Actually, thank you. Nice to meet you. This is our first time, but we working with the WHO, WPRO, and the WHO Philippines and many countries office very closely. My
Ehin was born out of WPRO.
no, I'm working with the headquarters about the digital health maturation model too. And my burning question is that the same tools or is the deriving tool? Because of 2 or 3 years ago, I heard that the consultant from the UK had been working with the Wipro for the Pacific, has come up with what you mentioned, 100 something indicator. That is very comprehensive and very good. So is it the works of the WHO WIPO regions, or it is the derived from the digital health maturation model that the digital division, digital health and innovation department in WHO headquarter doing that?
Okay, thanks a lot for the two comments as well as questions. It's very important. So luckily, I have to see what WHO did for the past 2 years is to compare all the existing maturity tool. So this is the same one you were exploring together with our HQ. So basically, this is the same one HQ WebPro are collaborating together, trying to finalize it, to make it better. And for the PIC one, WebPro developed 2 years ago. Like I said, it's covered over 150 indicators, too comprehensive. That's why HQ, the Data Innovation Department, DDI, they collaborate with all the regions in 6 regions together, trying to mapping all the existing maturity tool, as well as some other international platform. Then we are able to mapping totally 500 indicators. And luckily, because of this mapping and compiling procedure, we are able to have the current latest tool. So hopefully, that's also related with your question. It's already achieved to the compilation and integration, as we said. And meanwhile, it's a dynamic tool. So we're hoping to update it every year as well to make sure the emerging area is being covered, as well as other new tools developed by other platforms can also be merged. At least up to now, it's merged all the existing
I think they are become converging. That is very good. When we are discussing in the HQ about it 100 and 500 indicators and the campaign from the country, and it seems like the WHO WIPO do a very good job on trying to condense it to 40 indicator and 7 add another 3. That is and another thing that I would like to thank the WHO WIPRO is that you can bring all the East Asian country to come up with. Before it seemed like we are alone. In South and South Asian country, no Japan, no Korea. This is a very good opportunity that we are going to work with the East Asia.
Yes,
that is very good. Thank you.
Yes, thanks a lot for the comments. I have to say, our Chinese, Korean, Japanese experts are already in our expert team. That's why we are evaluating this all together. So hopefully we have more experts. Over.
Hi, Duan. There's a question on the chat, but I'll read it for you. Can this tool be used by hospitals to measure their maturity and at the same time measure the maturity level of the workforce on data lifecycle? This question is from Sherito Mekwes.
Sure, thank you, Dr. Vasila. So this tool is actually trying to use at country level, national level, not hospital level, because several questions is related with your strategy, national strategy, enterprise planning, your infrastructure. So probably not suitable for a hospital level. However, it can be tailored into provincial level or region level. as well as even district level for some country with very big population size. I believe, for example, Philippines, it definitely can be adapted to 3 or 4 lower levels, not only national level. Over.
Okay. So thank you for that. See, again, a round of applause for Dr. Duan. Yeah, so it's really more exciting if you're here face to face for interactions like that. So thank you, Dr. Duan. It's a good thing WPRO is actually based in Manila.